Medicare annual enrollment is underway, and you might be thinking, I've already got a plan, I don't want to worry about it. But listen, plans change and so do your needs. So choosing the right plan for you is very important this time of year.
Absolutely. Mary Liberty Gibbs, she's here with us from Healthcare Partner Nevada's Durango Hills My Generation Senior Clinic. There's a lot of words.
That's long.
It's great having you.
Thank you. I'm very good. How are you?
Very well. Let's talk about Healthcare Partners first and what it is that you do.
So I am one of the primary care providers in the clinic, and I help the seniors, or what I like to call them, the mature population.
The mature adults.
The mature adults,
Love
the
it.
mature population, with their healthcare, basically.
Yeah.
So I make sure that I understand their history, their medical history and everything, and based off of themselves, I make a personalized plan for their healthcare.
Fantastic.
Excellent. And this time of year is especially important to many of your patients.
Right.
During open enrollment. What do you see as the critical issues that people should always look at every year?
So every year, you always want to make sure that you have the right person in your background for healthcare, right? So your primary care provider is very vital to it all.
Absolutely.
So you want to make sure that provider, even though they should know everything, can't do everything themselves. So you always want to look at their team as well and make sure that their team is actually a good team and fits with you. So during these times, we always want to make sure that you look at how your primary care is actually helping you. Are they in a location that you want them to be at? Can you get into an appointment with them soon? Can you get them when you have an urgent need? Are they in your network? You know, what kind of communication line are you actually having with that provider?
Yeah.
In Healthcare Partners, we have a model that we follow. It's called the coordination of care, where everyone in that patient's care is talking to each other. So. Yeah.
That's the important thing. Like, think of it like a playbook in football. You know, the quarterback's on one play, but then you have to, like, for 20 minutes, sit down and tell the other person, you know, the wide receiver over there, no, here's how it works.
Right.
Whereas with this, everyone that's on the team is playing by the same playbook.
Pretty much, yeah. So everyone's on the same page, even the specialists, the medical technicians, the nurse care managers, everyone knows about this patient who's in the center of the care. And everyone is on the same page for that person.
And I love the feeling, even for myself as a patient, of having a whole team of people looking out for me.
Absolutely.
Sometimes you can feel almost helpless as a patient.
Right.
When you don't know who to reach out to, or you don't know who to follow up with.
Exactly.
Right?
Right. So like I said, I can't be there everywhere, but there's
Yeah.
always going to be someone on your team that you can reach out to.
Right.
There's always, if you need something urgently that day, you can call our clinic or contact somebody, and that problem can get taken care of that same day, possibly.
And same day issues are often extremely important for seniors.
Absolutely.
So that's great.
Yep.
No question. This is why annual enrollment is so important. I think people, they get on that plan, they're like, okay, well, I'll just have that plan. It's worked out what's worked out. The plan, even though it might have the same name, can change.
Absolutely.
Yeah.
Yes. So the plan, even though it does have the same name, can change, and you have to look into that. You got to make sure that the plan that you're in right now is still helping you out with what's going on.
Yeah.
Because as you get more mature in age, you actually have different needs as well. So in your plans, you want to make sure that to see what other benefits that they offer. So do they have vision, hearing, dental also involved with it? Do they offer gym memberships? There are some memberships that actually do that and give you access to a nutrition specialist or something. You also want to look at your medications. What are you taking currently?
Yeah.
You want to write them down, look at the cost, because that can change from year to year as well.
So you have these My Generation senior clinics here in town that
Yes.
seem to me to just be a very streamlined place for seniors to get health care.
Yes.
And folks should really look out for those. And they're located all over town.
All
aren't they?
all over town. So we have 27 My Generation senior clinics that are spread out throughout the valley, pretty conveniently. So there should be one pretty close to you wherever you may be in the
How
valley.
can we make sure, if we are using one of your My Generation senior clinics, that the plan we choose will be covering Healthcare Partners?
Well, all that information you can totally find on our website.
Okay.
There are actually tools on there that you can look at, and another tool to help you get in contact with one of our representatives to make sure
Excellent.
that you actually are in the plan that is right for you.
Fantastic. Well, it's
Excellent.
great having you.
Thank you
Great
so much.
information.
Great to have you.
Absolutely, thank you.
Yeah.
Partners Nevada.
That's right. They have 27, Sean, My Generation senior clinics throughout the valley, providing concierge-style care and covered under certain Medicare plans, of course. Make sure to research your selections during the Medicare annual enrollment now through December 7th, everybody. To learn more, visit the website, call the number on your screen. Healthcare Partners Nevada, a proud sponsor for the Morning Blend.